Hello. Whenever you are caring for someone, you have a responsibility to keep them safe and well. One way of doing this is by reducing the risk of infection. We call this infection prevention and control. Here are some important steps you can take to stop infections spreading. The best way to prevent the spread of infection is through good hand hygiene. Always be bare below the elbow when looking after people. This means you should not wear a watch or any jewellery, apart from a plain wedding band. Sleeves should be rolled up above your elbow. You can use alcohol gel to clean your hands when there is no visible dirt on them, but it will not kill all bugs. If your hands are visibly dirty, or after you have used alcohol gel 3 times in a row, you should wash your hands with soap and water. You should follow the 5 moments for hand hygiene for the best results. Here are some examples of when to clean your hands. Before touching a patient. Before an aseptic procedure, such as changing a catheter bag. After coming into contact with bodily fluids, for example faeces. After touching a patient. When looking after patients with diarrhea and vomiting. And after touching a patient's surroundings. If you suffer from eczema or another skin condition, you will need to seek medical advice. Personal protective equipment, such as gloves and aprons, must be worn according to your local policy and thrown away in the orange clinical bins. Gloves and aprons must be worn when sorting dirty laundry, which must be placed directly into laundry bags and not left on the floor. Communal equipment, such as commodes, hoists and blood pressure cuffs, must be cleaned between each patient use. Keep the area you work in clean and free from clutter to reduce the risk of infections. If someone has an infection, which is at high risk of spreading to others, for example diarrhea and vomiting, then they should be isolated. If you are unsure about which illnesses require isolation, please speak to your manager or the local infection prevention and control officer. Isolating someone means they should be in a single room with ensuite bathroom and hand hygiene facilities if they live in a care home. Gloves and aprons may need to be worn when entering the room. If needed, please arrange for the person to be seen by a healthcare professional. Always remember to keep a record of anyone who has an infection. Occasionally, you may need to report to Public Health England, for example if a patient has measles, mumps or food poisoning. You will be told if you need to do this. If you start to feel unwell, seek appropriate medical attention. If you have an infection, you may be advised not to care for someone or go to work for a period of time. It is your duty to follow this medical advice. Remember, everyone is responsible for reducing the spread of infection and protecting the people we care for.